Доброго дня, шановні колеги. Good afternoon, dear participants and delighted speakers. My name is Evgen Kushnir and I represent Alliance for Public Health from Ukraine. Welcome to the War in Ukraine session. I wish we never had war in my beautiful country and never had session with this name, War in Ukraine. So my best words and praise are today to the brave Ukrainian people and to our fantastic armed forces. I have only one wish, is a peace and victory to my country. Despite bloody wars that Russia started almost 3 years ago, our organization, Alliance for Public Health, not only limited services but expanded them and introduced some new services. The Alliance identified the third of all new HIV cases in Ukraine and introduced groundbreaking innovations, including long-acting PrEP, ensuring continuous treatment. Mobile clinics expanded services to frontline areas, and humanitarian aid was provided for IDPs and military personnel. This session, War in Ukraine, explores innovative strategies developed to address the complex challenges posed by war on Ukraine. During this session, we will examine the war's impact on drug use trends, healthcare disruptions, and illicit markets. It will also highlight the resilience of harm reduction services in engaging key populations, ensuring access to HIV, hepatitis, and TB prevention, and providing comprehensive support to displaced persons. Today we have 5 distinguished speakers with us, so it will be 5 topics, up to 10 minutes each, and then we will have questions and answer session and discussion. So welcome, I will introduce everybody and then we'll go to the presentation. So welcome John Collins, who is the Director of Academic Engagement and the Global Initiative Against Transnational Organized Crime based in Vienna. John also serves as the Editor-in-Chief of the Journal of Illicit Economies and Development, LSE Press, and board member of the International Society for the Study of Drug Policy. He is also a fellow of the Center for Criminology at the University of Hong Kong and visiting fellow at Shanghai University. Second presenter is Evgenia Kuvshinova, the Executive Director of All Ukrainian Charitable Organization Convictus Ukraine. This organization implements programs on harm reduction, HIV response, gender-based violence, and develops support services for IDPs and key groups. Organization reaches annually more than 55,000 people from vulnerable groups and works closely with governmental and non-governmental organizations. She is also a delegate from non-governmental HIV service organizations to the National Council on HIV/AIDS in Ukraine and chairs the program committee of this council. The third speaker is Yanina Stemkovska, who is the director of the NGO Eastern Resource Center of the Ukrainian Network of People Who Use Drugs, Meridian. She is also regional representative of the Ukrainian Network of People Who Use Drugs, Volna, and Ukrainian representative in UN Mode, which is a EECA region community network to access justice. And she is also a consultant of the Prison Health and Rights Consortium project. Another presenter is Svetlana Bolsheva, who is the head of programs and projects at the Free Zone charitable organization. For over 10 years, she has been working in NGOs on HIV prevention and harm reduction, and for the last 4 years, she has been working with people in conflict with the law, including people in prisons. Her organization believes that convicts are an important resource for society, providing them with timely assistance in resocialization and integration after release. And the last speaker is Konstantin Belikov, Deputy Mayor of the city of Kryvyi Rih and also Head of Coordination Council of Kryvyi Rih for combating infection diseases. He is also a member of the Regional Committee for Healthcare, Childhood and Maternity. To city of Kryvyi Rih signed Paris Declaration, one of the 5 cities in Ukraine that signed Paris Declaration. And municipality is fully supporting NGOs and communities in implementing HIV programs for KPs. So this is what our panel will be about and who are our speakers. So let's start with the first speaker. Dear John, the floor is yours, please.
Do you need me to use the microphone or can I speak? I do need to use it. Okay, great. Well, thank you everyone for being here. It's a great pleasure and it's great to see so many friends. I'd like to particularly acknowledge my colleagues on the Ukraine Working Group, Neve, Tony, Olga, Kimberly. I know there's others that I'm missing. But it's a real pleasure to be able to be here and present, and I think in some ways I'm presenting in part on behalf of that group as well. So the work that I'm going to present is based on the work of the Global Initiative Against Transnational Organized Crime. We run an observatory on illicit economies and organized crime in Ukraine. We conduct a lot of research on various topics, but one of them is drugs. Now, I wanted to clarify this a little bit. When I say DDR here, I hope nobody mistook that for demand reduction. Actually, what we're talking about is disarmament, demobilization, and reintegration. We're talking about it specifically about drugs from a military issue and a conflict perspective. So just to keep that in mind. Do I have a flicker or? Perfect. Okay, so to set some basic premises on this, the first thing is that we know that illicit drug use in Ukraine is having a significant impact within the army. We know that that organized crime is very much involved in supplying drugs to the front lines. So there is not shortages of drugs in many conditions under the front lines. We know this is also being replicated for Russian soldiers. So on the Russian front lines, we're seeing a lot of active drug use and we're seeing a lot of organized crime involvement in supplying it. We know that soldiers use drugs for a variety of reasons, simply just to escape, maybe to stay awake, to relax, to deal with PTSD, perhaps as painkillers or anxiety, or else just basically to manage the existence on the front lines. Or they may have had pre-existing drug dependence issues when they actually got to the front lines. We know that there's a significant shortage of treatment services for veterans, and that they're at significant greater risk. And in our 2024 report, we made the point under the DDR heading that drug use is not just a public health issue that is for the main urban centers or for traditional audiences. This is something that you need to apply to soldiers. You need to be thinking about your harm reduction services. We know that goal 4 of the operational plan for the implementation of drug policy strategy in Ukraine is the expansion of harm reduction services. That's why it's very different from Russia. We know that there is a very different approach to, in principle, drug policy in Ukraine. But there is a long way to go. There is a real need to scale up a lot of these programs, and there are significant obstacles remain, as we know. Stigma, general shortages, resourcing issues, etc. So what were the immediate outcomes for Ukraine of the full-scale invasion? Well, the first thing was you had a disruption of the drug economy. So one of the main things we saw, and I'll come to this in a moment, was the disruption of the port of Odessa. That had significant supply disruptions within Ukrainian drug markets. The second is that we saw shifts in market dynamics, right? So we see the emergence of ATS and particularly salts becoming more prevalent in the Ukrainian context, and heroin being solidified as sort of what we would call a great absentee. Now, I would be very interested to hear thoughts of people who have service provision expertise on the ground in Ukraine, what their thoughts are on the current situation with regards to heroin. And then, of course, the third point, which is around the impact, the social impact of the war on soldiers and the harms that that's going to cause. Oh, wait, I didn't actually flick forward. I'm mixing my slides here. Apologies. Okay, so as I said, what we have with cocaine, relatively stable demand. We saw initial disruption through the port of Odessa, but what happened? Basically, supply routes shifted west. So we now see cocaine coming overland through Europe. We see an uptick in seizures. We see prices more or less stable. So the cocaine market has not actually been significantly altered by the war. Heroin, as I said, it seems broadly absent. There is some indications, we're seeing some very light evidentiary indications that it's starting to emerge in the east of the country, but that is very much to be confirmed. Again, salts as a major rising issue, and alpha PVP, which is one that we've done particular work on as a key example of that. So you can see that with the case of cocaine, the shifting trends there where Odessa shuts down, and now through Hungary, Slovakia, Poland, etc., you see cocaine routes re-emerging. It shows the adaptability of these markets. Similarly with COVID, when we thought drug markets were going to have a huge supply chain disruption, it actually proved to be pretty short-lived. The Ukraine conflict has been another example or case study in that. Heroin, as I said, we have seen a significant rise in illicit production of methadone, and clandestine laboratories being consistently dismantled. We also see alternative substitutes emerging. So buprenorphine, nalbuphine seems to be a particularly recent one on the black market, and actually also something that we're seeing on the front lines, that soldiers are sourcing it out. It's not officially prescribed, is my understanding, on the front lines as a battlefield medication, but it seems to be one that is being used quite a lot. Salts, again, I've mentioned this. We see a lot of precursors coming in from China, Poland, Turkey, and Egypt, and there appears to be a premium when we talk to organized crime actors or people in the illicit market in Ukraine. There seems to be a premium on it for people who have specific expertise, or cooks, effectively, who can manufacture these drugs. We see comparatively low prices, which suggests they're pretty well-developed markets with wholesale capacity. And that telegram channels are being used for basically dead drops quite significantly. And this is something we're also seeing on within Russian cities as well, this wholesale move towards dead drops, or this very significant move towards dead drops via telegram. And our latest data from Odessa suggests that we're seeing significant amounts of salts also being taken to the front line through the postal service, and then effectively armed platoons meet these salts and act as distribution networks. So there is quite organized operations emerging seemingly around distributing these kinds of drugs. Cannabis, I'm not going to speak much on because I know people are quite familiar with the background of it, and there was also a panel just about it. So when we talk about treatment services for veterans, well, what we're seeing, of course, is increased drug use as self-medication. And so this is obviously going to have serious consequences in terms of blood-borne viruses, risk for fatal, non-fatal overdose. Now, what we know is that in the DDR discussion, we consistently speak as if there is a new cohort of people who use drugs going to emerge out of the conflict. But a lot of the people who served had pre-existing drug dependence issues. And we know now that opioid substitution therapy or drug dependence issues is not a disqualifier for serving in the army. But the problem is that you're not allowed to access OST while you're serving, and you can be dishonorably discharged, you can lose access to benefits, your family can lose the access to payments if you're killed in action, etc. So there is a very significant disconnect between Army policy and what is needed around harm reduction services, and creating conditions where people in a destigmatized way can firstly operate on the front lines, and then when we do start looking at questions of demobilization, God willing, whenever that is, that we actually have a rational approach to what demobilization will look like. You know, one of our reports talks about voluntary screening, right, of a variety of things: STDs, bloodborne illnesses, indications for drug and alcohol abuse, right? These should not be stigmatized about catching people, but these should be screening what are going to be very traumatized and very problematic cases of people coming off the front lines and trying to reintegrate into normal life. I won't go into much more about these. I draw a lot from my colleague Tony Duffin's papers on this, around what sort of principles could we look at as we're designing harm reduction policies for a post-war context. But co-production, I think, is a particularly important one. I think traditionally there was a sense of military families were different from the kind of families who would have to deal with drug treatment services in the past, right? The military is special, and these families would not associate or identify with the kind of services that many of them now are going to actually require. So I think there is a shift in this required. I think I'm running out of time. So, 1 minute, yeah, so I'll just wrap up. So conclusions, One of the points I would like to make, and one of the things we're most interested on, and as part of the Ukraine working group we're working on, is this impact of security. And using security as a lens with which to advocate a drug policy reform framework, right? That the changes in the links, so the immediate break, a pretty revolutionary is not the word, but a very significant break in links between Russian and Ukrainian organized crime is quite an opportunity. But also the shift of Ukraine well out of the kind of traditional Soviet style, I know it had already significantly moved beyond that, but the shift towards a more European style, European integration style drug policy represents a significant opportunity. And one of those is going to be around how do you regulate black markets? Because a key security issue is that we talk a lot about geocriminality. Russia, for me, is the archetypal geocriminal state. It uses organized crime, it uses illicit markets to penetrate and undermine other countries and actors. And so this is, I think, a really important point that needs to be tied with these discussions of harm reduction and public health reform, is that drugs as a security issue can actually make it a reform issue in Ukraine. Right? And I think that's something we really need to hammer, and it broadens the audience and it makes it, I think it brings in new actors. As I say, I've already highlighted what the MOD arguably needs to do. I think there's a lot of work, especially by many people in this room, underway around that, but I think that is going to be really key as we look to an eventual DDR strategy. So thank you very much.
Yeah, thank you, dear John. All the questions will be after all 5 speakers finish. So the next speaker is Evgenia Kuvshinova, who will share the work of Convictus Ukraine in 2 regions in Ukraine during war. Please, Evgenia.
Good afternoon, dear colleagues. It is an honor for me to present experience of our organization today. And Convictus has over 70 years experience and works in Kiev and 11 regions in Ukraine. Among the main areas of our work are harm reduction program combating HIV, tuberculosis, hepatitis, providing access or essential services like psychological support for vulnerable groups, supporting victims of violence, and providing humanitarian assistance for victims. Over the year, our work reached more 51,000 people, making a significant contribution to improving public health and social well-being across Ukraine. The war in Ukraine has created many challenges for harm reduction, prevention, and medical services. Constant shelling, occupied territory, destroyed infrastructure, and logistical problems hamper access to vital services. At the same time, there are growing need for basic services and supplies. Despite the challenges, non-governmental organizations, government organizations, and international donors are working together to respect quickly and flexibly. Convictus Ukraine, we are doing everything we can to ensure that our harm reduction programs continue to work. We are focused on supporting our team and ensuring capacity to work with key population. We provide comprehensive assistance and support, finding the resources we need to continue our work. Ensuring uninterrupted of harm reduction services is one of our topics during the war. We have adapted to challenges such as population displacement, destroyed infrastructure, and security threats. Mobile clinics and outreach teams help us reach people in remote and war-affected areas, bringing essential services directly to communities. In addition to distribution syringes, condoms, lubricants, and HIV testing, we distribute basic necessities such as food, hygiene items, and warm clothing. During the war, the need for these items were extremely high. We regularly work to mobilize additional support to meet these needs. We also focus on ensuring that people living with HIV can continue to receive antiretrovirus therapy without interruption. This includes supporting those who have been displaced and moved to other regions, working closely with local health facilities and partners. We track and deliver RT, supporting thousands of people. We work to ensure that no one is left behind, even in the most challenging conditions. In the Kyiv region, we provide social support to people who take in opioid substitution therapy. In addition to basic services, we help clients access critical medical diagnostic and ensuring timely and accurate diagnosis. Psychological support remains a vital part of our work, helping people cope with stress and trauma during these challenging times. That's why we are now developing mental health program and strengthening our collaboration with friendly doctors. We see that comprehensive care is very important at this time. And I would like to share more about our integration center. In Kyiv region, Convictus Ukraine has established an integrated service center that provides comprehensive service for people who use drugs and their loved ones. This center is safe and friendly space where people can get harm reduction services, take an HIV test, get registered and receive antiretroviral therapy and comprehensive support. An important point is this, that a person who uses drugs here has a short pathway from HIV testing to ART and can receive treatment in our center. In addition, we provide assistance in diagnostic and treatment and help to prevention of tuberculosis, hepatitis, psychological support, and humanitarian aids. One of the strongest advantages of this approach is accessibility. People who use drugs do not face bureaucratic barriers or the need to visit several healthcare facilities. Instead, they find a multidisciplinary team ready to provide all the services they need in the one place. Over the past 2 years, we have seen that this model is very effective and provides clients with timely, comprehensive care in a stigma-free location. This approach greatly improves resiliency in treatment. Of course, partnerships have been critical in supporting our programs during this challenging time, during wartime. We work closely with medical institutions, government organizations, and NGOs to ensure the harm reduction services, HIV treatment, and support for key populations are available. Resource mobilization is another key aspect of our work. We look for additional opportunities to strengthen our programs. It is also important to work at the state level to ensure that we do not lose the focus on achievements of Ukraine recent years in developing harm reduction program and fighting HIV and TB. We can see a little bit more about our program coverage. The first graph shows how number of people covered in our programs grow from 2022 to 2024, and expected data for 2024 shows that we will maintain this high level, researching over 40,000 people. Second graph shows us the number of new HIV cases and people received antiretroviral therapy in our organization from 2022 to 2024. In 2024, we continue to work and ensure stable program implementation. The third graph shows the number of clients received regular assistance in the comprehensive service center. I would like to pay attention. The center is unique in that it offers safe and discriminatory center, and now we ensure providing people 120 clients for received IRT. This is the average number at the state IRT site in Kyiv region. And I would like to summarize some our conclusions. First, through adaptive approach, we were able to ensure program stability and uninterrupted services in Kyiv and Chernihiv region. Second, effective HIV treatment support has been provided. Our organization with health facilities ensure uninterrupted care for clients. Third, access to opioid substitution therapy was maintained. Social support for people on OST improves the effectiveness of the program. In addition, comprehensive service centers have played an important role in Ukraine. These centers provide comprehensive services in safe, non-discriminatory place. Finally, we have integrated mental health and GBV services into our programs, taking an important step towards comprehensive care. I would like to express my heartfelt gratitude to the international organization who made this work possible, the Global Fund to Fight HIV, tuberculosis, malaria, the Center of Diseases Control and Prevention, CDC, the PEPFAR program, USAID, and other international donors and partners organizations who continue to support Ukraine. Also, I would like to thank every person around of the world who cares about Ukrainians. Thank you very much for your attention. We stand strong together. Slava Ukraini!
Yeah, thank you, dear Evgenia, for your work in Ukraine during these tough times. The next speaker is Janina, who will be presenting us with the results of a project on what the name is? Forcibly displaced people, Ukrainian prisoners to Russia. And Janina, she will have no slides, but only speech, and we will have a consecutive translation with the support of Hanna. Thank you, Hanna.
Говори, я думаю, що нормально працює.
Шановні колеги, пани та панове, вітаю, мене звати Яніна Стемковська, і я з України.
Dear colleagues, ladies and gentlemen, my name is Yanina Stemkovska, I'm from Ukraine.
Сьогодні я б хотіла вам представити результати та висновки нашого проєкту, який був реалізований міжнародною правозахисною мережею UNMODE разом з організацією Меридіан, яку я представляю, який стосувався соціально-правової допомоги насильства переміщеним до Росії українським в'язням.
Today I would like to present to you the results and conclusions of our project implemented by International Human Rights Network UNMODE in cooperation with the Meridian charitable organization, which was related to the social and legal assistance to Ukrainian prisoners forcibly transferred to Russia.
У листопаді 2022 року ми зіткнулися з жахливою реальністю. Українських громадян, що відбували покарання в місцях позбавлення волі в Херсонській області, було незаконно переміщено до Росії. В Росії, перебуваючи в умовах повної ізоляції, вони не мали змогу лікуватись від захворювань, не мали змоги отримувати будь-яку допомогу чи підтримку. Піддавались стигмі та дискримінації, побоям та знущанням.
In November 22, we faced a terrible reality. Ukrainian citizens serving sentences in prison in Kherson region were illegally transferred to Russia. In Russia, being in conditions of complete isolation, they could not be treated for diseases, could not receive any help or support. They were subjected of stigma and discrimination, beaten and abused.
Після закінчення терміну покарання, коли багато хто з них чекав на звільнення, натомість вони були переміщені в міграційні в'язниці, де їх могли утримувати без обмеження в часу, очікуючи на депортацію. Але в умовах відсутності дипломатичних відносин між країнами депортація була неможлива.
At the end of their sentences, when many were awaiting release, they were instead placed in immigration detention centers, where they could be held indefinitely pending deportation, but in the absence of diplomatic relations due to the war, deportation is impossible.
В умовах міграційних в'язниць доступ до медичних послуг був відсутній повністю. Це створювало критичну ситуацію для здоров'я тих, хто потребував антиретровірусної терапії, протитуберкульозної терапії та опіоїдної замісної терапії. Ми розуміли, що нам необхідно діяти, і тому ініціювали судові розгляди в Росії, щоб домогтись видворення цих людей з Росії. Таким чином змогли забезпечити їх повернення в Україну через треті країни – Грузію та Молдову.
In the condition of migration prisons, access to medical services was completely absent. This creates a critical health situation for those who needed antiretroviral therapy, opioid replacement therapy, and antituberculosal therapy. We understood that we needed to act, and that is why we initiated legal proceeding to get these people expelled from Russia. In this way, we were able to ensure their return to Ukraine through third countries, Georgia and Moldova.
На жаль, це було доступно тільки для частини колишніх ув'язнених, у які були паспорти з діючим терміном придатності. У більшої кількості бенефіціарів документи були втрачені або навмисно знищені при незаконному переміщенні до Росії. Ці люди досі перебувають там і перебувають у міграційних в'язницях.
Unfortunately, this was only available to some ex-prisoners who had valid passports. In the case of larger number of beneficiaries, the documents were lost or specially destroyed during the illegal transfer to Russia. These people are still in immigration prisons.
Навіть після звільнення та покинувши Росію, наші підопічні стикнулися з новими викликами. Після прибуття до третьої країни вони не мали жодного юридичного статусу, як то біженець чи тимчасовий захист. Це означало, що для забезпечення доступу до медичних послуг вони мали очікувати не менше 30 днів, протягом яких було позбавлення необхідного лікування. В результаті ми були змушені нелегально перевозити життєво важливі препарати з України, щоб гарантувати, що люди зможуть отримати хоч якусь необхідну терапію.
Even after the release and leave in Russia, our wards face new challenges. After arriving in the third country, they didn't have any legal status, refugee or temporary protection, none of this. This meant that they had to wait at least 30 days, during which they were deprived of the necessary treatment to ensure access to medical services. As a result, we have been forced to illegally transport vital drugs treatment from Ukraine to ensure that people can get the treatment they needed.
Незважаючи на всі труднощі, наш проєкт досяг значних результатів. Ми змогли допомогти 432 колишнім українським ув'язненням, з яких 101 людина успішно залишила Росію, 47 з них пізніше повернулися в Україну, 44 особи змогли успішно соціалізуватись у третій країні, отримуючи допомогу та підтримку на новому місці.
Despite all these challenges, our project achieved significant results. We helped to at least 432 former Ukrainian prisoners, of which 101 person successfully left Russia, and 47 of them later returned to Ukraine. 44 people were able to successfully socialize in third countries, receiving help and support in the new place.
Але попереду нас чекають нові виклики. Ми побачили, що проблема доступу до медичної допомоги залишається серйозною та продовжує актуалізуватись. Відсутність доступу до базової медичної допомоги, в тому числі до опіоїдної замісної терапії, викликає криміналізацію своєї поведінки. Люди частіше порушають законодавство про наркотики та знову потрапляють до в'язниць.
But new challenges await us ahead. We saw that the problem of access to medical care remains serious and continue to be relevant. Lack of access to basic medical care, including opioid substitution therapy, leads to the criminalization of their behavior. People are more likely to violate drug laws and end up in prison again.
Тому дуже важливо продовжувати таку роботу, привертаючи увагу до потреб вимушено переміщених осіб та допомагаючи зміну законодавстві, щоб забезпечити їх права та доступ до медичної допомоги. Дякую за вашу увагу. Разом ми зможемо зробити світ кращим.
Therefore, it is still important to continue our work, drawing attention to the needs of forcibly displaced people and pushing for changes in legislation to ensure their rights and access to health care. Thank you for your attention. Together, we can make the world better and fairer for those who find themselves in a difficult situation.
Thank you, Janina. Thank you, Hanna. The next speaker is Svetlana, who will be sharing work with the prisoners who provided services as a peer-to-peer in Ukraine.
Thank you. Good day, dear participants. Thank you for coming to discuss the important topic of implementing harm reduction programs in prisons. Our organization, Free Zone, was created in 2018 by people who were formerly or currently in prison with the goal to protecting the rights of people in prison through innovative practice. We believe that with support and right conditions, prisoners and those recently released can be valuable to society. And today I will talk about providing harm reduction in Ukrainian prisons through P2P model, unique model in prisons in Ukraine. I'll also discuss the social support of people who use drugs after being released. As this is vital of their reintegration, especially during wartime. Some words about background. Around 40,000 people are currently in Ukrainian prisons, with about 10,000 released each year. A recent 2023 survey showed that 51% of inmates have used drugs, with 29 persons using them inside prison. In the past, harm reduction services were usually provided by specialists from NGOs, but due to the restrictions on visiting prisons, remote locations, and COVID-19 limitations, these services almost stopped. The war in 2022 made the situation worse. Airstrikes, evacuations, damaged logistics, and occupation of certain areas complicated everything. That's why our experience in involving inmates as peer counselors became essential to continue harm reduction services. Access to clean needles in prisons is limited, which is one of the main reasons HIV rates in prisons are 9 times higher than in the general population. Even though needle exchange programs have existed outside of prisons for 25 years, they weren't available in prisons until 2022 in Ukraine. The Free Zone organization is unique in Ukraine as it has been involving prisoners as harm reduction workers in prisons since 2017. These peer workers motivate inmates to join harm reduction programs and test for HIV, distribute needles through needle exchange points, provide overdose prevention information and materials, assist in early detection of tuberculosis and refer inmates to health workers. Encourage HIV, TB, hepatitis treatment adherence. Provide basic legal help. We train these peer workers with materials and online courses that cover ethical norms, basic counseling, harm reduction in prisons, and legal issues. Between 2020 and 2024, we trained over than 2,000 inmates, with 89 officials hired by NGOs and 98 working as volunteers. Every institution, every prison and pretrial detection centers where we often harm reduction now has been peer consultants among the prisons, And we've provided over 10 tables and 20 computers to support their work. This P2P model has allowed us to maintain harm reduction services in prisons almost continuously, even through the pandemic and the war. In 2021-2023, we advocated for legislative change that now allow inmates to have up to 5 syringes in their possession if needed. In 2023-2024, our trained peer workers provided over 25,000 harm reduction services, including needle exchange, overdose prevention counseling, and support for HIV and hepatitis C treatment. Over 1,000 prisoners who use injection drugs received services, and more are being tested and treated for HIV and hepatitis C. By the end of 2024, we plan to open needle exchange programs in 2 more prisons. Thanks to our advocacy, since October 2024, needle exchange services in 1 prisons are now funded by the state budget, which we hope will make these services sustainable. Our organization also has considerable experience in supporting people released from prison, including PVID and those on OST programs. We were one of the first organizations to respond promptly to the war challenges. From the beginning of March 2022, thanks to a wide network of regional coordinators and partner organizations in all regions of Ukraine, we actively began to accompany the released prisoners, providing them with their priority needs for food, transportation to safe places of residence, temporary housing, restoration of documents, and refuels to local NSPs and OST sites to receive the necessary services. The comprehensive approach ensured continuity of access to treatment, prevention, resocialization, and the development of less risky behaviors. The formation of a responsible attitude to one's own health, and as a result, slowing the spread of socially dangerous diseases. During the 2020-2024, as part of number of projects supported by international donors, the Free Zone managed to provide social support services to almost 5,000 released prisoners from the most vulnerable categories. Given the current difficult conditions, the provision of support services to people released from prisons in the context of harm reduction is particularly relevant as it helps to ensure the community to their receipt under any external condition. In 2025-2026, we aim to expand peer training in all prisons in Ukraine so that inmates can continue helping each other. Free Zone also plans to keep supporting prisoners, including people who use drugs, to ensure they have continuous access to harm reduction. We will also work on moving their funding for harm reduction programs in prisons to state support to ensure sustainability during wartime. I could talk for a long time about the work of our organization, This is really interesting and important why my time is limited. So thank you for your attention. If you have any questions, please feel free to ask. Thank you.
Yes, thank you, Svetlana. And the last speaker of our session is Konstantin Belikov, who is the deputy mayor of Kryvyi Rih. Kryvyi Rih is just a bit of information, is second or third longest city in the world, and the distance of Kryvyi Rih is something like 130 kilometers. So it's a very, very long city. And it's a great honor that here during the conference we have not only people from NGOs, from communities, but from the municipalities, government decision makers. So thank you again to the city of Kryvyi Rih for signing Paris Declaration and for making everything you've done for the last couple of years. So we will also have a translation consecutive with the support from Hanna. Hanna, thank you again.
Good afternoon, ladies and gentlemen. My name is Konstantin Belikov, Deputy Mayor of Kryvyi Rih City. Дозвольте почати з приємного. І, користуючись нагодою, поздоровити нашого сьогоднішнього спікера Євгена. У нього сьогодні день народження.
Точно. We will start with the birthday wishes to Yevgen. He's today have birthday, so it will be nice starting of my speech.
До речі, в нього дуже чудові гості на його дні народження.
And
Дякуємо вам.
he have absolutely amazing guests in his birthday party. At 8 there will be the continuation party.
Для мене велика честь представляти сьогодні місто фортеця Кривий Ріг на такому поважному зібранні.
For me, it's a big honor to present here on the fortress city Kryvyi Rih.
Сьогодні, нагадаю, 1014-й день збройної відсічі російської агресії з України.
Today is 1014th day of the armed protection of Ukraine from the full-scale invasion of Russia.
У 22-му році саме Кривий Ріг зупинив російську навалу на південному сході.
In 2022, our city stopped the Russian army on the southeast.
Саме в Кривому Розі наприкінці 22-го року планувалася і почалася визвольна операція на правому березі Дніпра Херсонської області.
From Kryvyi Rih in autumn 22, the counter operation started to free the left bank of the Dnieper and to free Kherson.
Сьогодні населення Кривого Рога становить 690 тисяч мешканців.
Kryvyi Rih population is 690,000 people.
Ми являємося єдиним містом в Дніпропетровській області, яке залишається в зоні підвищеного ризику поширення ВІЧ та туберкульозу, а також розповсюдження наркотичних речовин. Протягом останніх років благодійна організація «Благодійний фонд громадське здоров'я Кривого Рогу» у співпраці з міською владою робить значний внесок у боротьбі з епідеміями.
Kryvyi Rih is one of the cities of Dnipropetrovsk Oblast who still remain in the risk of HIV and hepatitis C and TB infections, and a charitable organization, Public Health Foundation, together with the administration of Kryvyi Rih, doing what is possible to cooperate effort.
25 листопада 2021 року Кривий Ріг підписав Паризьку декларацію та приєднався до програми Fast Track Cities. Для забезпечення максимальної ефективності ініціативи Fast Track Cities місцева влада разом з неурядовими нашими організаціями розробила усі нормативні документи, що стосуються місцевого рівня.
In November 25, 2021, Kryvyi Rih signed the Paris Declaration, and with support of our civil society partners, we developed all the local regulations and legal acts which is needed to respond to the Paris Declaration and to change the situation.
Хочу нагадати, що з початку російської агресії Кривий Ріг прийняв майже 100 тисяч вимушено переміщених осіб. І, на жаль, серед них є ті люди, які страждають і на ВІЧ, і на туберкульоз, а також страждають вживанням наркотичних речовин.
Since full-scale invasion, we had more than 100,000 displaced people from other oblasts of Ukraine which are occupied in Kryvyi Rih. Some of them living with HIV, some of them using drugs. And unfortunately, they could not stay in usual shelters and camps for displaced people because of the stigma and discrimination.
За підтримки і фінансування ЮНАЙЦЕС та підтримки мерії Кривого Рога громадська організація «Громадське здоров'я» міста Кривого Рога відкрила шелтер «Україна – це велика родина» для представників вразливих груп населення та членів їх родин серед внутрішньо переміщених осіб. Міська адміністрація допомагає усім можливим шелтеру, зокрема постачання продуктів харчування, хліба, води, овочів та іншого.
With the support of UNAIDS, the local charity organization and administration opened the specific shelter, which called Ukraine is a Big Family, for representative of key populations affected by HIV, and administration is responsible to provide food kits, bread, water, vegetables to all shelters in the city.
Чому партнерство є важливим? По-перше, це координація зусиль міської влади, державних установ і благодійних організацій надає змогу зробити профілактику та тестування доступними для всіх верств населення, організувати інформаційні кампанії для зменшення рівня стигми, надавати комплексну підтримку людям, які живуть з ВІЛ та їхнім сім'ям.
Why we need cooperation between civil society, charity organizations, city government, and state institution. Because only with this cooperation we could properly organize the prevention and testing for all population and subpopulation, organize informational campaigns, and provide comprehensive support to people living with HIV and their families.
До речі, хочу зупинитися окремо на проблемі розповсюдження наркотичних речовин.
Additionally, I want to stop on the challenges connected with the drug use.
Як мій колега сьогодні зазначив, на жаль, збройний конфлікт тільки підсилив розповсюдження серед воїнів Збройних сил України.
As my colleague today on the session described very well, the war conflict and war in the country strengthened the situation and worsened the situation with the spreading of drug use among the people who are in army, but also among the civilians.
На жаль, інформація щодо вживання наркотичних речовин на полі бою або безпосередньо в тих бойових частинах, які воюють, є закритою.
Unfortunately, we do not know the prevalence of drug use and situation with drug use in the front line. It's closed information.
Але безпосередньо спілкуючись з представниками Збройних сил, можна сказати, що десь кожний четвертий боєць, який до цього не вживав наркотики, в тому чи іншому сенсі попробував наркотичні речовини за ці 2,5 роки.
But when I'm communicating with the soldiers, I see that one of four have experienced use of substances during these 2.5 years, even if they haven't used before.
Або в якості знеболюючого, наприклад, буприморфін.
It could be pain-killing, for example, buprenorphine.
Або в якості допінгу.
Or it could be doping or stimulant.
Тому що витримувати наступи ворога по 5-6 суток, не маючи сну, це дуже важко.
It's very hard to fight for 5-6 days without sleeping. So that's almost impossible for human being.
Що ми маємо далі? Ми впевнені, що колись це закінчиться нашою перемогою.
We are sure that we will win and everything will finish with our victory.
Але хлопці повернуться в свої сім'ї, в свої домівки, і там будуть їх чекати дружини і діти.
But the soldiers will come back to their families, to their wives and kids.
І ми вже сьогодні бачимо, що коли відбуваються дуже короткі і дуже відпустки наших земляків-побратимів, виникають певні конфлікти на цій почві.
And we already see more conflicts based on this issue in the families during the short vacations people have from the serving from the front line.
І ми хочемо звернутися до шановних наших партнерів з тим, щоб подовжити співпрацю і подовжити допомагати українцям подолати ці наслідки.
And actually that's request to all our honorable partners to help us to cope with these consequences of the situation and with the situation itself.
Я хочу подякувати нашим американським, європейським, зокрема польським партнерам за всебічну підтримку.
We are grateful to all American, European and specifically Polish partners for full-scale support to us.
Це такі організації, як USAID, UNITES, Альянс громадського здоров'я, благодійна організація громадського здоров'я, благодійна організація 100% життя.
And particularly UNAIDS, USAID, the Alliance for Public Health, 100% Life, and the charitable organization Public Health.
Я рахую, що ми разом переможемо не тільки на полі бою, а й в житті, в мирному житті.
I believe that we will win not only in the front line in the war, but in our life.
Слава Україні!
Героям слава!
Thank you so much. We're almost like Swiss watches. We are on time, just 1 minute later. So now it's time for questions and answers session and some kind of a discussion. So we had 5 speakers and someone who has a question. May you raise your hand? Yeah.
My name is Sergey Rudy. I'm from UNODC Program Office in Ukraine. I'd like to thank you, Mr. Collins, for your presentation and the very bright data about drug use. And my question is, where you get data from, please?
Do you want to do a couple of questions, or you want me to answer? We have a variety of sources. So of course we go through official data, but with a good deal of skepticism, as I'm sure you do as well. We do have a lot of people on the ground collecting data. So we send people into the field. We talk to, frankly, we go in and talk to criminals. Which? Yeah, it's great data. That's not our only source, but that is a very significant source that we rely on. We also pull data from Telegram and things like that, but a lot of it is talking to criminals and talking to frontline actors and getting information from them, and we then try to verify it.
More questions? Yes, please.
To thank all the presenters and to wish Ukraine every success. I'm Tony Duffin. I'm the chair of European Harm Reduction Network. My question is, there's been a lot of very, I suppose, disturbing things that described around the war and the psychological issues that are occurring now and the trauma that are occurring now, and then what will happen when the war finishes and Ukraine is victorious. And you know, there's been this description of people coming back and being traumatized and post-traumatic stress. And it's going to be quite overwhelming. The number of people. So my question is from a harm reduction perspective, what is the priority? What would people like to see done now, done first, to get ready? The most effective thing that, you know, because money will be, funding will be an issue, so what can people think we can do? To the panel, particularly to my Ukrainian colleagues, I guess I know it's a difficult question.
Thank you so much. So who will respond on the?
Я тоді попрошу перекласти. Аня, Тетяна. Да?
Я воєнні терміни не знаю.
Спробуємо без термінів. Оскільки я представляю організацію, яка досить вузько, але працює
As I represent the rather narrow organization who are working with the imprisoned population, very narrow focus.
Ми вже зараз бачимо збільшення ув'язнених, які мають бойовий досвід, які були на війні і які зараз в тюрмі за різними злочинами, в тому числі стосовно наркотиків.
We already see the more people who are imprisoned and who have the fight experience and have been in army, and including for the different crimes, but that includes the drug use, possession, and all the issues connected with the drugs.
І тому для нас зменшення шкоди в тюрмах, розширення тюрем, де є доступ до зменшення шкоди, і обміну шприців, і замісної терапії, всіх цих для нас важливо, щоб вони мали доступ. Тому що дійсно, як колеги казали, багато хто повертається, і навіть коли ніколи не вживали наркотики, починають вживати саме у війську, і опиняючись в установі, їм важко, тому що вони, у військових, які опиняються в установах, трішки інша ситуація, не вважаю, і відчувають себе по-іншому. А тут ще й питання наркотиків.
And especially, that's why for us, priority is to have harm reduction in all the prisons available for everybody. Because actually the soldier who is imprisoned already have some specific feelings. But if these people imprisoned, if they addicted and if they are using drugs, then it's additional challenges. So we need to cope and to help them there in the closed settings.
І ми розуміємо, що в першу чергу це дійсно політична воля людей, які приймають рішення на рівні міністерства, але дуже добре показали себе саме рівні консультанти, які з числа таких самих ув'язнених, числа таких самих воїнів, і вони можуть консультувати. На це у держави, на забезпечення такого грошей немає, тому ми чекаємо, дуже сподіваємося, що донори продовжать допомагати саме з цим моментом.
We all understand that that's very, very complicated issue, and it's hard to get the political will of decision makers on the ministerial level with these pragmatic decisions. And we all understand that the money will be an issue. That's why we still want to rely on the support of international community, international donors, at least for some time being. In these programs, in the harm reduction programs.
І остання ремарка. І оскільки ми допомагаємо людям, які звільнилися вже, і після звільнення, саме зв'язати їх, переадресувати до програм зменшення шкоди в цивільному секторі, для нас також важливо, щоб вони продовжували працювати, і ми могли переадресувати цих людей до організацій в цивільному секторі.
As Free Zone also making this linkage of people who are free from prison to the harm reduction in the free life, that's for us important to make, that's one of the priority, to make this connection and to have the continuity of harm reduction from prison in free life for these people. Там же ще хочуть відповісти. Хто ж задав таке велике
And
питання?
I would like a little bit add. Thank you very much for the question. Like I said, it is very important to develop help and support for mental health. And I would like answer for your question for two sides. First, it is about support and help those who help. I mean our social workers and employees of our team. It is very important to ensure that we have a capacity to provide services in the like basic principles, yes. And now a lot of things about supporting program to our social workers. It is very important. And next, and another side, it is about to develop our harm reduction program and maybe open more for another possibility. For example, we now start to provide evidence-based practice. For example, it is Self-Help Plus. It is program which approved WHO, and it is program to help organize some groups for helping people who use drugs or another key populations, and to help provide through stress and other things. But I think it is very important to develop services from doctors. Now we see that we very need help for psychologist, psychiatrist, neurologist, and another. Medical assistant and medical support together united with social support, it's very important too. And thank you very much.
Yeah, again.
Sorry, guys, I would add from the institutional level about this question. Last week, we had a very comprehensive conference in Kyiv for 3 days about the mental health and how the government in a wide understanding of all entities, are going to reply and address the rising issue of drug use and drug misuse at the same time among veterans. So there are numerous governmental entities coordinating its work with the parliament members, with the parliament at all, with the presidential administration, with the professional society of medical doctors, psychiatrists, with psychologists, with different UN entities and projects or thank you. And with donor organization and institutional development organizations like USAID, like PEPFAR program, like the European Union Advisory Mission and other. And it is quite comprehensive approach with updating from legislation level, then lower to the level of the resolutions of the Cabinet of Ministers with new paradigm of service provision, with new entities, with new scheme, for example, for in an outpatient treatment, which kind of programs will be applied, who will train the professionals, who will update psychiatrists' knowledge, what about the recovery, what about the rehabilitation, and how this rehabilitation will be funded and done. And it is quite comprehensive, very complex process, but we already launched that and hope will somehow succeed. Thank you.
Thank you very much. So do we have more questions or comments from anybody? Yes, please.
Thank you. It will be more a comment than a question. I'm representing the Pompidou Group of the Council of Europe, and we have been working with Ukraine for more than 10 years quite fruitfully, and we established a good cooperation. So maybe just to add the contribution of the Pompidou Group, how to interact with people who suffered the difficult circumstances in their lifetime. In 2024, with the full-fledged Russian aggression on Ukraine, Pompidou Group has also provided the support, and we elaborated the toolkit on how to deal with people in crisis situations and following difficult life events. So it's a toolkit where we teaching people how to talk to people who suffered difficult situations. So this toolkit can be used, as we discussed, the people coming from the war, how to talk to them, how to discuss, how to establish the communication. So it could be quite useful. It's available in Ukrainian, so it can be shared and shown how to talk and interact with these people. Thank you. And thank you for everything you are doing and working on the front line in Ukraine. Thanks.
Thank you so much. One more, okay. Unlimited questions.
To just a quick one, more of a comment really, to my friend from Free Zone, who mentioned the partnership between international colleagues and our colleagues in Ukraine. I would just call on everybody at the conference to engage with the 36 delegates from Ukraine and offer whatever help they can. For my part, next week, next Tuesday, I'll be presenting to the Department of Justice in Ukraine and members of psychologists across prisons to describe some of the work we do with policing and prisons and health in Ireland. So I just want to mention that and ask that everybody try to connect and help. That's all.
Yeah, thank you so much. I guess everyone is tired, yeah. It's almost 5 p.m. So I want to thank to our speakers. I want to thank to the audience, to technicians, to our beautiful to Hanna. Yeah, I can't call you translator. To Hanna who helped us. Yeah. So thank you so much, and really hope that next year the war stops and we will win.